people know the term propofol associated with Michael Jackson and his death, sadly. Can you talk about propofol, what it is? And people are like, well, I'm not going to take propofol because that's what killed Michael Jackson. So talk about that.
Yes. And that for that reason, there's certain medications that I hesitate to say by name whenever I'm interviewing patients. Propofol is one of them, and also fentanyl is another one of them. So if I can get away with it, I try not to mention medications. Whenever I do bring up propofol and a patient has a question about it, here's the way that I explain it to them. Michael Jackson did receive propofol, but it was not administered under proper conditions. It was not given by an anesthesia physician. He was not being carefully monitored. And every anesthetic, whether it be general or the monitored anesthesia care, we carefully monitor the patient. We monitor your blood pressure, your heart rate, your heart's electrical activity, the amount of carbon dioxide that you're breathing out, your oxygen level. And so, with all of these monitors in place, it's safe to give you a medication like propofol. And propofol is one of our favorite drugs to give because it is pretty fast on, it's fast off. Patients usually wake up feeling actually really good. People say it's one of the best naps that they ever get because it gives you a very pleasant sensation. And so for most patients receiving a colonoscopy and upper scope, different other procedures, we like propofol a lot.
Yeah, I want people to hear the word, to bring up the association with Michael Jackson's unfortunate death, because propofol is a wonderful drug. It's extremely effective. And as you said, fast on, meaning it puts you to sleep fast, fast off, meaning you wake up faster. It really is a very nice drug. And I think it has gotten a bad rap. And I don't want people to be afraid of it when they hear it from the anesthesiologist during the interview.
Yes. And so I think after I kind of explain it to them, just as you have explained it just now, patients usually feel a lot more comfortable with receiving it because they know that someone from anesthesia will be in the room with them the whole time, monitoring them very closely. During a colonoscopy, for example, I'm right there at the patient's head, watching them breathe, looking at all their vital signs, so that in that way it's safe.
Everyone knows that the surgeon or the interventionalist is going to perform the procedure. But what a lot of people don't understand is that these procedures need to be performed in conjunction with the anesthesiologist who's going to do the other half of the lift. So there's a process. Just a surgeon just doesn't say, "Hey, I'm going to operate, on your heart or your knee or your hip," and then, take you back to the operating room the next day and do the operation. Every patient who is going to go and be exposed to some type of anesthesia under the care of an anesthesiologist should be spoken to by an anesthesiologist. Explain why and what that conversation looks like.
Correct. So before surgery, we have to make sure patients are optimized or ready to have surgery. We do get a lot of patients who are healthy, but many patients have a long list of complex health issues, and we need to make sure that those things are optimized before surgery because anesthesia puts stress on your body. Surgery puts stress on your body, and if you're not well optimized, if you're not ready, then you can have complications afterwards. So before surgery, we usually review a patient's medical history and we determine if certain tests are needed. And so some people need to have a chest x-ray. Some people need to have an EKG. Many patients have to have blood work drawn so we can see what are your blood levels, what are your electrolytes. Some patients need to see a specialist if they have a complex heart history. So if you have a pacemaker or a defibrillator, we need to know that those devices are working properly. If you have severe COPD, we need to make sure that you're taking all of your inhalers, that your pulmonologist says that you are good to go. So we serve as perioperative physicians before surgical procedures to make sure everybody is ready before surgery.